Chapter 1 Savage Isle. In my mind, there are black and white photos. They float around, landing softly here and there, resting on top of other memories, dreamscapes, and nightmares. Sometimes they bloom color, like the one I'm focusing on now, and unfolds like a flower, an opening for the sun, the petals wet and dark. Slowly it bleeds brilliant pigments, dark sky, clear rain, yellow headlights. A boy with curly hair and a crooked grin, Jason in the rain, my favorite memory of him. "When was your last period?" the nurse asked me. "Alice?" The nurse's voice is like snapping fingers calling me to attention. The images fade, white paper crinkles as I shift uncomfortably on the exam table. I try to count the hours, the suns and moons, and remember how much time had passed since the fire. It's been weeks, I think. Tsunamis has decimated cities in less time than that. I rub a hand over my chest where breathing is still difficult. The nurse's white ID badge reads Nurse Dummel, Oregon State Mental Health Hospital. I recognize her face from before, from my last day here. The face of a bulldog. Round cheeks set over a row of bottom teeth that stick out just a smidge too far. Nurse Dummel clears her throat. I don't know, I say. I'm not sure. Maybe 2 weeks ago? I swallow. Even though it's been a while since the fire, my tongue still tastes of ash. Maybe it always will. Nurse Dummel types something into a computer, and how are the burns? The burns that travel over each shoulder blade and down past my right wrist tingle. Miraculously, the fire didn't touch my left hand. The skin there is still soft and smooth. Better, I say. Although I don't remember the fire, I do have some fuzzy recollections of my intensive care stay. The bitter uncertainty of those days and the bright, bright pain that just wouldn't go away. That's all, the nurse asked. No pain, numbness, or swelling? No, it's just itchy now. Outside, the wind howls and shakes the thin walls of the building. A shudder rolls through me. Oregon State Mental Health Hospital is located on a thin strip of densely forested island. The hospital advertises itself as a peaceful haven where troubled souls recover, but there's nothing tranquil about this place. Even the name of the island, Savage Isle, was born from blood. In the late 1800s, a Native American tribe was forcibly relocated here, only to be killed later in a massacre. Old newspapers say there was so much blood that winter it looked as if red snow had fallen from the sky. That's good. You're lucky you couldn't feel anything at all. Some second-degree burns cause loss of sensation. Lucky. Am I lucky? That's not how I would characterize this situation. You'll need to stay on antibiotics for the next couple of weeks and keep it up with your physical therapy. I almost laughed. When I left the ICU, a doctor gave me a pamphlet on hand exercises, explaining that they would help me regain full mobility. That was only physical therapy I received. I flexed my hand now. The movement causes a subtle ache, but other than that, everything appears to work just fine. A white wristband prints out next to the computer. Left wrist, please, Nurse Dummel says, gesturing for me to hold out my arm. I comply as she snaps on the tight plastic. There are 4 colors of wristbands at Savage Isle. I have worn them all before, all except for red. Nobody wants a red wristband. Upon admittance, everyone is given the standard white, and after a period of about 24 to 48 hours on semi-restricted status, they're usually granted a yellow wristband that comes with a few restrictions. After yellow comes green. Green means go. Stay up late, visit home, drink caffeine, get out of Savage Isle. All right, kiddo, Nurse Dummel sighs, handing me a pair of ratty scrubs. Stand up, take everything off, and put these on. I wait a heartbeat to see if she's going to leave and give me some privacy, but she just stands there watching me with a hawk stare. I change quick and quiet and think of Jason. When we kissed, his lips tasted like fresh spring water and hot tamales. I don't have the courage to ask about him in the hospital. I feared his fate. Sometimes not knowing is better than knowing. Still somewhere inside me the truth clanks like a ball and chain. It's not possible he made it out of the fire alive. I ignore it. Denial is kinder, more gentle. Uninvited, though, thoughts of Sully pop into my mind, but I push them away. I refuse to waste worry on my twin. Worry is lost on her. When I finish putting on the scrubs, I throw my hoodie back on, hoping the nurse will let me keep it. I didn't like being cold. She doesn't notice or pretends not to, and gestures towards my shoes. All right, shoelaces have to come off. This is your bag? She points to the corner of the room where a lavender duffel sits on the floor. It's worn and dirty, the color almost bleached to gray. I pull my sneakers off and de-thread the laces. The nurse shakes her head a little as she slips on a pair of latex gloves. She picks up my bag and places it on the exam table. In a detached and efficient manner, she sorts thoroughly through my things. A couple of pairs of pants, some shirts, an iPod, toothbrush, toothpaste, some floss, and origami paper, all my worldly possessions. She holds the origami paper up and raises her eyebrows. I mirror her look, resisting the urge to stick out my tongue like a petulant child and snatch the sheets from her fingers. They were a gift, a gentle reminder to Sally and me that we weren't always alone. I don't want Nurse Dumble's greasy fingerprints all over them. When she sets them aside, I'm relieved. You're good to go, she says. You can pack up everything except these. Nurse Dumble confiscates my toothbrush, floss, clothes, and headphones and dumps them into the plastic bag. I quickly tally the number of items left in my possession. An iPod that's useless without the headphones, some toothpaste just as useless without the brush, and my origami paper. Nurse Dumble opens the door and gestures for me to follow her. I gather my 3 remaining possessions and place them in the lavender duffel bag, careful not to accidentally crease any of the origami paper. Outside the exam room, a big guy with a mullet stands guard. He follows us as we walk down a hallway that quickly turns into another, a sterile maze. We pass a sign that says Admittance Ward C, then another that says Patients Only beyond this point. He swipes a badge over a black box and the door swings open. I shift my duffel bag uneasily. There's a familiar rush of anxiety as we come to a second set of doors. Once again, the guy with the mullet swipes a card over a black box, and the door seems to magically swing open. As soon as I stepped over the threshold, they swing shut behind me with a soft clink. The place looks the same as when I left it, like something ate the 1970s and then threw up all the furniture here. We're in the common area, the co-ed area. There's a box TV with 2 channels, one with good reception. We used to have a DVD player from movies, but some kid peed on it and shorted it out. There are a couple of couches with pillows that look like they're frowning all the time, some cracked green leather chairs, a few imitation wood tables, and steel mesh on all the windows. I think about the time I visited the zoo as a kid, pressed my face between the steel bars of the polar bear cage, and watched the animals pace. Their padded feet were silent and had worn huge gaping tracks in the dirt. How many months would it take to make such deep grooves? My toes curl in my laceless shoes. The common area is empty, probably because it's close to dinner time. The smell of beef stroganoff permeates the air. Donnie will take your bag to your room, Nurse Dumble says. I shrug the duffel off my shoulder and hand it over to the tech. He takes it from me, narrowly avoiding skin-to-skin contact. The nurse keeps walking, and I hurry to keep pace with her long strides. The C ward is shaped like a circle with 3 arms, the common area at its center. 2 of the arms are long hallways that stretch into dead ends. They're all patient rooms. One hallway is for boys, the other for girls. The third hallway houses the cafeteria, the recreation room, where you can glue shells onto wooden boards or ride one of the 3 exercise bikes, classrooms, doctor's offices, and group therapy rooms. The nurse leads me down to the third hallway towards the doctor's offices. She pauses in front of a plastic chair just outside a door across from the cafeteria. Wait here, she says. She knocks on the door and then enters. I look at the chair. Its cracked seat looks uninviting and painful. I jam my hands into my hoodie pocket and lean against the wall. I've just begun to chew on the inside of my cheek when there's a buzz, followed by the cafeteria doors swinging open. A steady stream of teens emerges. Their gaits are sluggish and their gazes downcast, like they're afraid to make eye contact. Sully used to tell me that they were like jellyfish. Over-medicated jellyfish. Gelatinous balls whose touch is poison and who always have to move, because if you stop moving, you're dead. Most of them I don't recognize, which isn't a surprise. Savage Isle is state-funded, so patients are encouraged to stay for as little time as possible. Plus, my last day here with Sully was cut short, I should say, barely enough time to make friends or, in Sully's case, enemies. I study the new crop of patients as they exit the cafeteria. A second buzzer sounds and the jellyfish move a little quicker, a change in the tide, off to the common area or rec room for free time. The irony is not lost on me.